demonstrating how to set up the operatory. And Ms. Kristen Turner is our videographer and our narrator today. She's one of our clinical instructors. So we're doing it along with the competency form. So if you could follow along on your competency form with what we're doing, then that would help you learn the steps. Okay? All right. Ms. Turner, if you could start, then I will just follow along as she reads off the competency.
Okay. First step, we're going to wash hands.
Okay. You're going to wash your hands, and you should have learned your hand washing by now. We're going to do it twice because we're just coming into clinic. And you should do this every time you come into clinic and before you leave the clinic floor. Wash your hands. Use sanitizer in between. Okay, that should do it. And then we're going to dry our hands with some paper towels. Okay, what's our next step, Ms. Turner?
Secure utility gloves.
Secure what?
Utility gloves.
Okay. I've got these down here. Usually we keep our utility gloves up under the sink when we're not using them because we don't want them sitting out where the patient can see them.
And also the cleaning detergent from under the sink.
Okay. Cleaning detergent is we use what is called a simple green. And it's just a cleaning solution, and we do a little bit of housekeeping first. We just do some cleaning before we disinfect.
And put on PPE and utility gloves.
Okay, PPE first.
Yes.
Okay. Put on my gown. So you're going to put your PPE on, which consists of your gown, your eyewear, and your mask. And your gowns are going to look a little bit different than this one. But it doesn't matter as long as you're covered. You should have learned what your PPE is by this time as well. And you might want to think while you're looking at your competency form what the importance is of having PPE on while you do this process. Put my eyewear on and my mask. Okay.
And now we will clean all housekeeping surfaces with the simple green cleaner.
Okay, let me get my gloves on here and we'll get busy with that. Kind of awkward wearing these gloves, but you get used to it after a while. So you're going to use some paper towels, and you're going to wet the paper towels with your cleaner. And you want to saturate it pretty good, and once it dries out, you want to put more cleaner on your towels. So what am I going to be cleaning now?
You will start with the horizontal surfaces of the walls.
Okay, so that's these areas here. We want to make sure that we're getting the dust and debris that may have accumulated. We want to get all the horizontal surfaces that we see and clean the barrier between the units. Okay, let me do the other side. You want to do this every time because dust and debris does accumulate. Okay, what do we do next?
And now the horizontal surfaces of the CPU.
Okay, CPU, of course, is your computer unit. That's what it stands for. Okay, so we're going to do that.
And now it's the computer monitor and
We have computer monitors which are mounted and they come up overhead. I'm going to put a little more of my cleaner on my towel. It's getting a little dry. Now we do not want to clean the screen itself. We just want to clean the monitor. Get above it. Clean the handles on either side of it. And we need to clean up here. Of course, you don't need to clean the other because you can't reach that high. Okay.
next is the view box and the power switch.
Okay. View box is this on the wall here for your radiographs. If you have to do film radiographs, you're going to need your view box. And the switch is just on the side of the view box.
All right, next is the trash can inside and out.
You're probably wondering why we do the outside, because the outside does get contaminated from the debris that floats around in the unit. So we do the inside and we do the outside.
The rheostat and the cord.
The rheostat is a foot pedal. We call it a rheostat. It's the foot pedal that's at the base of the dental chair. So we're going to clean that off and we're going to set it on the floor so that it's ready for use. Okay? And we'll just throw this paper towel away.
Next is the water bottle and mounting arm.
The water bottle is at the base of the unit. It's this white bottle right here. We want to clean all the way around it. And we want to clean the mounting unit. Okay.
And all surfaces of patient chair, including upholstery.
Okay. Patient chair. So let's clean that really good. We don't use disinfectant on the upholstery because it cracks and it discolors the leather. But we can clean it when we're doing our housekeeping.
And now the operator and assistant chairs,
Okay.
including upholstery.
I'm going to need some new paper towels. These are getting worn out. So let me get some new ones here. You'll find initially when you do this that you're going to be kind of slow, but you will pick up speed as you get better. Okay, let's do the other chairs, including the upholstery. Chairs in each unit, so we want to make sure and clean both of them. One is usually used for the instructor because many times they want to sit so that they can do what you're doing. Okay.
Next is the light arm.
Okay. Your dental light is really important. You're going to be using that every time you see a patient. And the light arm includes the entire arm, so you have to start at the base and clean the entire area. Okay?
And now the mobile cart, all surfaces, inside out, and keyboard shelf.
Okay. All surfaces means top and sides, and the insides. So we're going to pull open the drawers, and we're going to pull the things off the shelves and clean those real well. again, the reason we do this is because it does get debris on it when you're working on your patients. Okay, we want to do the outside, the handles, and then we want to do the inside. If there's anything in the drawer, you need to take it out so you can clean the drawer very thoroughly and then put it back in. You want to clean off the shelves. If there's something on the shelf, then you have to remove it and put it back. And then return it. Please try to put things back where they belong. We have an issue with people putting stuff where it doesn't belong. This is a dental rat. You're going to be using this when you do your perio charting. And it always goes on the bottom shelf. Okay, what's next?
Next, remove one utility glove and return the detergent bottle under the sink.
Okay. Oops. Not doing very well with paper towels. So we're going to place this under the sink, and we don't want to contaminate the door, so we're going to take the glove off. We're going to open the door. We're going to replace our... Okay. And next?
And now secure the disinfectant wipes from under the sink.
We're also going to grab those without a glove on. Close the door without a glove on. Put your glove back on, because now you're going to start disinfecting.
And we'll do the wipe, discard, wipe method.
That just means we're going to wipe the area, discard, and then wipe it a second time. So what you're going to do is go through the process one time and then go back and do it a second time. Okay?
And this is for all the clinical contact surfaces.
Okay.
Let's see. So first, soap dispenser, hand sanitizer, disinfectant container,
Okay.
sink top, and door handle also.
Okay. Got it. Both the sanitizer bottles. Do the sink top. And the door handles. Okay, what's next?
Operator and assistant chairs, the seat back and handles only.
Okay. What they mean by the seat back is the back of the chair here, because you're going to be touching that sometimes. And we're going to be touching the handles. We're going to put some barriers on it, but we're going to go ahead and disinfect it. I don't think that one has a handle. Okay, next.
Okay, so next is the assistant arm, the saliva ejector, high speed, and air water syringe.
This is called your assisting arm. What you do is take these off, hold on to them, clean the arm really well, getting in the little nooks and crannies. Again, try to clean it as thoroughly as possible. The better you disinfect, the better off you're going to be. Okay, what's next?
And the tubing.
Okay, so we're going to do the tubing all the way down. And we're going to replace the item in the assistant arm. Remember, this is just our first time around. We're going to do it twice. Okay.
All right, next is the patient chair headrest and the knob on the back.
Remember, we don't use this on the upholstery. Okay.
Mobile cart top and edges.
Okay.
Master control unit.
That would be this for your bracket table. This is a bracket table. This is your master control unit. Go ahead and turn it off until we need it. So let's clean that real well. Okay. Same thing, you want to take these off and clean these areas real well. And then tubing.
Yes.
Okay. Do the tubing just like we did on the other. You're going to be using this air water syringe more than the one on the assistant chair because it's easier for you to get to. And we'll replace them in their proper slots.
And then also the extension arm and the master control arm.
Okay. That would be this. And the extension arm.
And the dental light handles and power switch.
Okay. This is your dental light. Get another one of these. This one's getting dry. Once it starts to dry out, you want to get another one because you want it to get wet. If it's not getting wet, then it's not disinfecting properly. We don't want to do the actual light itself because this will stain it and mess up the light. So you don't want to do that. Okay?
And the computer monitor handles.
Okay. That would be these up here. You can just turn it towards you so you can reach both handles. Okay, next.
And now you want to do the second time.
Okay, so now we're going to do the second time. So let's go ahead and back up and we'll start narrating from where the beginning was.
Okay, so the first is soap dispenser, hand sanitizer bottles, disinfectant container, sink top, and door handle.
This is what we're talking about when we say wipe, discard, wipe. The same areas that we did before, we're going to just do it a second time. Okay. And, okay.
Next is the operator and assistant chairs, back and handles only.
Okay. Same thing we did before. Just move over it one more time. Make sure that we've disinfected it thoroughly. As we got all the bacteria and stuff off, we're ready to go.
Assistant arm, saliva ejector holder, high speed, and air water syringe, and tubings.
Okay, same thing we did before. We're going to clean off the assistant arm and the tubings. And you want to do the whole arm all the way down, not just this part here. Okay. You can see where when you first start doing this, it can take a little bit of time. Eventually you'll learn the steps and you won't have to use your form. But in the meantime, until you learn the steps, you can use your form. Okay, next.
All right, the back of the patient chair headrest and the knob.
Okay.
Mobile cart top and edges.
Okay.
Master control unit.
We're going to do tubing again. Try to put the tubing back in its appropriate place and not get everything tangled up.
And the extension arm. lights.
Make sure we cover that too.
Dental light handles and power switch.
Okay, so we should do this up here. And we'll do the handles and the switch. Don't forget this little curved thing in the back that holds the light. We get that too. Okay.
And computer monitor handles.
Okay. Again, we're going to, sorry, I'm throwing things around here. We're going to do our handles again. Okay.
All right, now we're going to bleed the water line for a minimum of 1 minute.
Okay. Let's turn our unit on. What we're going to do is we're going to take our air water syringe. We're going to bleed it into our suction. That's good. We're good. And you don't want the two to touch. You don't want them to touch. You want your water to be, to just kind of, you have to kind of aim it. It looks like we're out of water. What you would do, we're out of water. So what you would do is you would take your water and you would do this for the extended period of time to clean out the air water syringe area. Okay, next.
All right, next we're going to, we would remove items from our bin and place it in the car.
Okay, you're going to have a storage bin that you're going to be keeping in your clinic locker, and you're going to have items in that, and that's what we're talking about when we refer to the storage bin.
And same thing with the clipboard. We'll hang it on our
Have a
hook.
clipboard, and you will disinfect that, and you will hang it on the wall on your hook, which is next to your unit.
All right, now we're going to remove utility gloves and store under the sink.
Okay? And I think we need to wash our hands again.
That's the next step.
Okay, because I'm getting them contaminated by pulling off these gloves that have been wiping down surfaces. I need to put this away.
Yes.
So let's put that away. We'll put the gloves down here. And wash our hands again. Lots of hand washing as a hygienist.
Okay. Our next step is going to be to secure our barriers.
Okay. Barriers are plastic pieces or plastic bags that you use to cover your unit, so that you don't contact everything and contaminate everything when you're working on your patient. Get all this out here. Okay. Your barriers are located in the back of the clinic. Barriers are located underneath these cabinets here. Your blue barrier is located here, and this is your saran wrap. I've already pulled the individual items we're going to need just for the sake of time, and the items are listed on your form. So let's go ahead and get our barriers and go back to our unit. Okay. Let's just set our barriers on top of our cabinet. And you can stick this to the front of your gown if you want till you need it. Okay, what is our next step?
So the first is patient chair headrest.
Okay, that would be one of our small plastic bags. Fits nicely over the headrest.
Now the large plastic bag for the master control unit.
Okay, this is our large bag. I'm going to lift these up before you put the barrier on. and then put them back on. Because if you cover them, you can't use them. Just slide this over your master unit, just like so. And pull it back so it's nice and snug. And there went my barrier, so I'm going to have to go get another one. I'm going to leave that for now. I'm going to go get some more blue barrier, but we'll continue. I'll get the barrier in a minute. Go
Okay.
ahead.
Assistant arm, medium plastic bag.
Okay. We have a medium bag. It's a little bit smaller than the large one. It should fit over your assistant arm. Again, you've got to pull off the items before you put the bag on. And just slide the bag up over top of it, like so. And then put your items back on. Okay.
Now the computer keyboard with the large plastic bag.
Okay, we're going to keep this. We're going to set it aside because when we work on our patient, we're going to be doing what we call an extra intraoral exam, and then we'll put it on at that time. So I'm going to just store it here where the keyboard is for now. But you would put it on there during your extra intraoral exam.
Computer mouse with a small plastic bag.
Okay, we have a small bag, and our mouse is kept in a drawer, and we use that with our computer. Again, we're not going to cover it yet because we don't want to contaminate our barrier, so we'll just set that on top of our cart.
And now with the saran wrap, we're going to do the handles on the
Okay, so
operator.
you're going to take your big piece of saran wrap that you got, and you're going to tear it into small pieces and put it on the handles of the chairs. Kind of sticky, so you have to work with it a bit. Okay, let's tear off a piece. Okay, we've got two handles over here, so we'll get one. And then we've got a knob. Let's get the handles first.